We can also see changes in physical capability. So we'll see things like changes in appetite or weight with those kids. We'll see sleep disturbances. We can see sluggishness, and we can see agitation. And in terms of the behavioral signs, thankfully behavioral signs are important in the sense that they are easily observable. They're things that you can see and are easy to identify in the kids. But when you think about it, the type of behaviors that you're most likely to be seeing here are not behaviors that are completely uncommon. So things like avoidance or withdrawal, clinging, demanding, being overactive, being restless, or engaging in self-harm. So when you think about it, there's not too many kids that you've probably seen around that are not overactive to some degree or engaging in a lot of activities. So I think you had to really take it in the context of something that is different from what you would normally see. Adolescents are a little bit different than children. We see a completely different presentation with adolescents. The adolescent presentation for depression is a lot closer to what you see in adults. So we would see things like, the depressed mood, the sadness, the suicidal ideation, those sorts of things are a lot more prominent. Part of the problem about depression in teens, which makes it a little bit difficult to diagnose, is that a lot of adults expect teens to act moody, right? Teenagers are supposed to be depressed and full of angst and all those things. So often we look at it and say, yeah, they're just being a regular everyday teenager. Sometimes we overlook those things because we're assuming the behavior is normal. The other thing that we often see is adolescents are not exceptionally good at expressing themselves. They don't talk well to other people. They're not the one that's going to run up to you as a parent or a teacher and say, oh, by the way, this is how I feel. Usually they're a lot more quiet about it, and in fact, if they're going to talk to anybody, it's likely to be a peer, more so than an adult. But because they lack some of that awareness or are not totally in touch with that, because that's not the way in which they process information at that age, developmentally, what we see is that they may not be aware even that some of this is going on, and it may keep them from seeking help. So, when you think about adolescence, you say these symptoms indicate depression. So I like reading these. Poor performance in school. That could be pretty much anybody. Withdrawal from friends and activities. Okay, sadness, hopelessness, those are a little bit more evident, I think. Lack of enthusiasm, energy or motivation, anger and rage, overreaction to criticism. Teens never overreact to anything, right? So overreaction to criticism is something that really is a symptom of depression. Feelings of being unable to satisfy their own ideals. Poor self-esteem, guilt, indecision, lack of concentration, forgetfulness. Restlessness, agitation, changes in eating or sleeping. Substance abuse, problems with authority, and suicidal thoughts or actions. So realistically, like I said, we always have to be thinking about the behavior, because how many of these things could you say would apply to, any random teen that I could bring into the room? So we always have to look at it and say, is there something going on when we see those sorts of things? Red flags for us here. The big thing, and the thing that probably worries me most about kids, especially adolescents, when they are experiencing symptoms of depression, is that they tend to experiment with drugs or alcohol. And that's done in a way to basically make them feel better. They can also at that time become sexually promiscuous because, again, it's done in a way to make them feel better. One of the things that really sort of impacts on that is the idea that these things actually probably make things worse. It's not something that's going to make them feel better. It may make them feel better in the short run for a very small period of time, but in fact, these problems can make the situation worse. You may also see an increase in things like hostile and aggressive behavior, illegal behaviors, risk-taking behaviors, all those sorts of things as a result. In terms of depression, also especially with suicide, when we look at teens, 4 to 5 teens who actually attempt suicide have given prior warnings. So they've done things which actually have cued people into the fact that there's something going on. So things like suicide threats, direct and indirect, an obsession with death, poems, essays, and drawings that refer to death, overwhelming sense of guilt, shame, or rejection, changing in eating and sleeping patterns, and a severe drop in school performance. Again, one of these things in and of themselves is not going to be an indication that somebody is suicidal. And I don't want to give that impression because, you know, there's a whole actual subculture, if you want to think of it, of individuals who, you know, are very much into the dark side of life, where they do tend to be a little bit more obsessed with things like death culture. They write poems and songs about it and things like that. That's part of a culture. That's something that is normal for that group. That doesn't mean that that whole group of kids is suicidal. So we always, again, we take these things, we put them in the back of our head and we say, is there something else going on? Because there could be, or there might not be. In terms of treatment, treating children with depression is not the easiest thing in the world. When we take really little children, and you know, I've seen children as young as, you know, 3, 4, 5 symptoms of depression. It can really start that early. What can you do with a 4-year-old or a 5-year-old who's depressed? We generally don't bring them into an office and decide to sit them down and do cognitive behavior therapy with them, because it's hard enough to make a 4-year-old sit down, let alone do cognitive behavior therapy. So how do you treat kids when they're really young? For the most part, the only real treatment that's available is medication, because there's not a whole lot else that you can do. If you've got higher functioning or a little bit older children, you can sometimes get into some cognitive behavior therapy, you know, to teach them some basic strategies and things like that. When children get a little bit older, so we're talking about pre-adolescence, you know, 9, 10, 11, 12, that kind of thing, what we're seeing for the most part is that cognitive behavior therapy is the way to go. So for that age group, we often have things like groups that they run where a whole bunch of kids get together, they learn about the things, they get to practice them in the group. It's lots of fun that way. But medication is typically part of the picture as well. For adolescents, same thing. Cognitive behavior therapy, in particular, traditional, you know, talk therapy, where you sit down and go through things and talk about things, seems to be most effective. But again, medication, SSRIs tend to be part of the picture. And the reason for that is that we know individuals who have depression often have a very hard time getting going. Motivation is part of their problem. So it's hard for you to be motivated to be successful in treatment if motivation is part of your issue. So how do we get around that? Often it takes the medication to take the edge off of the depression symptoms so that kids are more able to focus on doing the work they need to do to get themselves out of the depression. What typically happens at that point is that we can start to wean the medication away. So the idea is they don't necessarily need it anymore once they've developed the coping skills. But you can't get them to develop and practice and you know, have those coping skills ready if they're in the depth of their depression. So it's typically both together. What's important about SSRIs in adolescents is that we know that there are certain SSRI drugs that when they're mixed with certain individuals, typically adolescents, they can actually lead to suicidal ideation. So if you have an adolescent that is put on an SSRI, typically what you will see is that they are monitored very closely for about the first 3 to 6 months to make sure that everything is okay, that we're not seeing an increase in symptoms. After that, if there's no problems with it, there's typically not a problem after the initial stages. So the big question is, what do you do? What do you do if you see somebody or you recognize some of these symptoms? How are you going to address it? One of the things that I would say, and I say this for everybody with respect to kids, is that you should be recognizing the good things. I think we spend far too much time focusing on the negative stuff and not enough time focusing on the good stuff. And it would make a lot more sense if people would just focus on the good stuff. But it's especially important for individuals who have depression because they are seeing everything through a negative lens. They are seeing everything as how it's the bad side. And it often takes people for a long time pointing out the good side before they're able to see it. Consistent and clear rules are really important. Kids will say they hate rules. They actually love rules. They just don't want you to know it. Rules are important for development because the world operates on rules. And if nobody had any rules, everything would be in complete and utter chaos. So we know rules are important. And kids thrive off of rules. So rules are really important for placing the consistency there, which will help the individual get through the depression. Be calm and speak calmly. We know that when kids do stuff, it really gets on our nerves. And we often will react to kids. So what I like to tell people is you need to step back and take a moment and walk away yourself. And don't talk about something until you're calm. Yelling, getting upset is not going to help anybody. It's not going to help you. It's not going to help the child that you have who has depression. So you need to be very calm and speak calmly. And then you're also modeling appropriate behavior by doing that. Always listen. That seems like a simple one, but it's the truth of the matter. You need to be listening. Because often what kids are saying, they're actually giving you another message. And often we don't pay attention to the other message. We sometimes don't even pay attention to what they're saying. But the bottom line is we should be listening. We should be looking at what they're saying. Spend more time with your mouth closed, right? Because a lot of people will be, the whole time, I guess, that you're not speaking, you're thinking of what you're actually going to be saying next. So when are you actually listening? So what we have to do often is actively focus on listening to somebody else. Spend time and be a part of their life. This one's also really important. It's not just about, I'm going to come home and on the weekends, it's my weekend, I'm going to go out and I'm going to party. I'm going to go spend time with my friends to get away from the children because I have to spend all week with them. That's not the way it goes. So what we know is that for parents, for teachers, for other professionals, spending time and being part of a child or youth's life is actually a really important factor. I like this next one. Accept the behavior occurs, not the behavior. Because I will talk about parents all the time. I say, you know what, you have a child that has what we call dysregulation because part of their brain is not working the way that it should, so they have trouble regulating their emotions. They have trouble regulating their behavior. So the parents say to me, well, then they can basically do whatever they want and get away with it, right? Because, they can just blame it on the depression. And I say, no. Because if I go out and I drive my car really, really fast and I get pulled over and I say, I'm sorry, officer, I've got a head cold. I wasn't really paying attention to the red light. What's going to happen? Well, he's going to say, I'm sorry you feel bad. Here's your ticket, right? There are consequences to your behavior regardless of what's causing the behavior because life is based on rules. So when I look at that, I say, well, what we can say is that we can be understanding of the fact that the behavior occurs. So I'm going to know that, yes, you might be upset, and yes, you're likely to say something or do something that you don't mean because you're upset. And I can accept the fact that that's going to happen from time to time because that's part of the disorder. But I don't have to accept the behavior. It's not okay for you to do that just because you have the disorder. So it's important to recognize that. As part of that, punishments need to be appropriate. We don't want people to be over-punished, if you want to think of it, for something that's not 100% under their control. So the idea is that if I go out and I do something right now that is completely under my control, I'm going to run outside, hop in my car, and I'm going to go out and I'm going to run somebody down the street, right? It's completely in my control. Or if I go out and I accidentally hit somebody on the road. Same behavior, technically, same outcome, technically. I've got consequences either way, but the consequences are going to be different based on the intent. So one of the things we have to keep in the back of our mind is that when we see an individual who has depression, let's say, for example, and because of their emotional dysregulation, they engage in behaviors, we have to say, okay, how intentional was that? Because we want to make sure that the consequences to that behavior are not over-consequenced. Because one of the things that we know about individuals who have depression is they have that negative self-view, right? So if we start over-consequencing them, they're not going to see that there's a natural link between the behavior and the consequence. They're just going to see it that everybody hates them. And you're only doing that because you don't like me. Because to them, they can't draw the conclusion as to the link between the two. So make sure natural consequences are good and that they're appropriate. Other tips, okay. You should probably try to help children and youth who have depression identify positives in their own lives. It's no good to just let it go. You need to sort of say, okay, look at that. Look at what happened there. Really focus on that. Reinforce the appropriate behavior. The thing that you want to see more of, you want to reinforce. Again, it's that focus on the positives. Because children don't live in a bubble, and we can't force them to just remain in a bubble for the rest of their lives. And you're not going to be there as a parent or a teacher or professional standing next to them every waking moment of the day. We need to teach them coping skills. We need to teach them what to do in certain situations so that when they encounter something, they know what to do. And the best way to do that is through practice. Because I can tell you that, we all go and we learn things like CPR, right? And I think, if I had to get anybody in this room to do CPR right now, how accurate would it be? Based on how long ago you took the course, right? If you're not practicing it on an ongoing basis, you tend to drift. So what that means is that the more practice you do, the more likely when you get into a situation, you're going to apply what you know in the proper way. Lots of times, children and youth, when they have depression, will have difficulty connecting their thoughts and their feelings, particularly around how irrational some of the thinking is. Because they make those all or none statements and those black and white thinking choices. They're not really thinking through all the details. So their choices are not always logical. So helping them to connect those things together is really important in terms of helping them to understand what's going on and why what they're thinking doesn't make sense in the real world. Involving kids in successful activities is also really important. Because one of the things that we know, again, children who have depression are often having very negative self-esteem, poor self-concept. Everything is negative. If we put them into activities where they are not likely to have success, so, you got a 50% chance of it being successful, 50% of failure, they're going to focus on the failure really, really bad if it happens. And there's a 1 in 2 chance it's going to happen. So what we want to do is to provide them with very positive, errorless learning experiences. So experiences where the success rate is going to be 90 or 95%, which means that in all likelihood it's going to be a positive thing. It will be something that they can get a positive affect from. And an instance where they're not going to have a negative that they can focus on. Social skills are really difficult for a lot of kids who have depression just because engaging with other kids when other kids don't understand you, when they have difficulty communicating with you, is not an easy thing to do. And if there is any stigma associated with your behavior, it can certainly have an impact on the way that you engage other kids. And knowing what we know about the way in which adolescent kids tend to treat each other sometimes, it's not a situation that typically breeds a lot of happy things. If anything, it's probably more negative, which when you have a child that has depression, that negativity is actually going to make things worse. A big one here, listen to what the child is really trying to say. This is another really important one, because what I find, again, like I said earlier, people don't listen. Often what we do is that we hear them say such a thing, but what I usually say is all behavior is a form of communication. So just because they say nothing is wrong, or they say don't worry about it, or I don't want to talk about it, or whatever, that doesn't, you have to look at what the behavior is saying. Because if somebody looks agitated and they're saying there's nothing wrong, chances are they're agitated, right? And what's important is to be supportive. And that doesn't mean that you're going to sit down and you're going to talk to me and you're going to tell me what's going on and I don't believe you when you say there's nothing wrong. That's not the way to handle it. The idea is to say something along the lines of, okay, well, if you do feel like talking about something because you feel like something's wrong later, just come find me. I always got time to talk to you. It's about putting it out there. Because what I find a lot, especially from adolescents, is adolescents are very much about testing the waters. They're not going to jump in there with both feet and go run up to somebody and say, hey, I want your help. They're going to come and sort of test you out. They'll say something and see how you're going to react to them, and whether you're going to be freaked out by it or whether you're going to feel that it's something you don't want to deal with, because they want to see. So if they come up and they say, I'm not in a good mood or whatever, and you go, well, don't talk to me, right? They'll know you're not approachable. So the idea is that if you can give them a sense of some sort of security around the idea that if they want to talk to somebody, they can come talk to you. That's really, in a lot of cases, what's important. The last one, which I think is probably the most important out of all of these, and I tell this to everybody, and I say it, to professionals, I say it to parents, I say it to teachers. Go get help for your own problems. You can't be an effective source of positive outcomes and, positive thinking and all those things for a child or an adolescent who has depression if you have any mental health issues yourself that you're not treating. We see this all the time in families because, we have kids, and I can bring kids in and I can treat them for an hour, and I can make a difference in that hour, and I can make them feel better. But if they go home and everybody in the house is depressed, really isn't going to make any difference at the end of the day, because the environment makes a big difference. So you need to get your own stuff in order to be effective working with other people. And I say that for professionals too, because often, teachers can be that person in a child's life who's that important person, who's going to make a difference for that child. And if you're the one that's also suffering from your own problems, that could be a missed event, missed opportunity that you could have done something to help that kid. This is my new slide. It's about stormtrooper emotions. Telling how a stormtrooper feels is like trying to figure out how an adolescent feels. You often can't tell by looking at them. So the idea is you should